chin supply there. Good. Set and hold.
Relax. Relax. Let it go. Oh, down.
Everybody, welcome back to the channel. It's Dr. Jonathan Pearlman. If you're new to our channel, thanks for tuning in. And what I really want to do is just dive right into the high-low table. So I hope my camera angle is good enough here that you can actually appreciate that this table is upright right now. And the big idea behind this, and one of the reasons that I wanted to make this video, or the reason I wanted to make this video today, was specifically to address for both patients and students out there, and even young doctors who are maybe considering why they should use this table, or if this is a table they should have in their clinic. Yes, it's a big heavy-duty table that is made for heavy-duty situations. And what I mean by that is the high-low table that we use in the Gonstead method is something that's upright, high, and then goes down to low, high-low. So the reason we do this is, as you can see, if I click something here or press a button, you can see that the table is going down low. And if you'll notice early in this video, like the first few seconds of this video, myself as a doctor, I was performing what we would call a prone or a face down procedure for a specific lumbar adjustment. I think a couple of them were thoracic adjustments. But the point is they were to address specifically prone lumbar adjustments. Now, why would that be important, or why is that relevant pertaining to this table in this video? Now again, you're gonna see, flip a switch and the table comes up. If you are a patient or a person who is suffering with a lumbar disc injury, an acute lumbar disc injury, how convenient would it be to walk into your chiropractor's office with a hurt back that you can barely get out of bed, it hurt to drive, it hurt to get here, you're rolling around, you need to ice all day, you're on a billion ibuprofen, and then you can just get up onto the table. That's the beauty of this table, and that's oftentimes why a Gonstead chiropractor will adjust with a face down or a prone technique. And this is so important for people to understand, both young doctor, student doctor, and patients alike, and that is that it is going to be intolerable for you with an acute, swollen, inflamed disc, usually an L4, L5, S1. I mean, occasionally you'll have a higher herniation, but almost always in the lower lumbar, that disc gets a bulge or a fissure. It's called a tear that sends this inflammatory cascade and could be bad enough sometimes where it actually causes a herniation. It's not that a chiropractor can't help you with that. It's you need to go to a chiropractor who understands the nature of a disc injury. And to be able to put somebody on here and make the type of adjustments like we showed you in the beginning of the video, again, is paramount. So what we got to do is explain a little bit of how this works. Now this has a locking mechanism on the table that I can lock or unlock. Most of the time when someone's getting adjusted on this and they need a certain amount of extension, it's going to be unlocked so we can actually push through here. This cushion works along with some gravity to be able to get a certain amount of extension and depth along the disc plane of the joint and be able to then release the joint in a comfortable position and actually reduce the pressure and begin to allow the disc to feel better, again, inhibit the pain receptor, the pain response, and begin to allow proper fluid exchange at the level of the disc. And then from there, it's going to heal more optimally. That's just how chiropractic works a lot in the joints. The beautiful part about this, again, is being pushing down and done, again, well by a chiropractor who's experienced enough and trained well enough to be able to make that a successful adjustment, is that it doesn't put any rotational force. As you can appreciate with this lumbar disc model, here it is again, this disc model of the annular fibers on the disc and a bone and a disc and a bone again with the nerve on the side. If we were to put you in a side posture position, there's always going to be a certain amount of rotational force, right? Rotational force this way and this way at the joint. Now, you completely eliminate that part of the equation if you can just go down on the disc, but it's not so simple, and my patients will tell you, it is not as simple as just pushing down. If you push down, oftentimes you can actually create an injury. But like I showed here in this video, there's actually a lot of priming and priming and priming and priming and pumping and pumping and prepping the joint. All those can be used interchangeably. In the Gonstead method, we talk a lot about pumping the disc. In the Dr. Pearlman world, I call it priming the joint, because we're priming and getting ready before we actually go through and make the fast adjustment. And then the prepping is the same thing that other people might say. I mean, I could do the same motion in the same vector, 35 times before we finally adjust it in the same amount of preparation. Now you can see at the bottom, there's this pelvic piece, and we need to be able to control how much depth goes into extension and how much the pelvic comes up, how much the pelvis comes up into flexion. So really there's probably more that I've left out, but up to this point, I really wanted to make this video and show you just how valuable this is as a tool, not just for a chiropractor, but as a patient. I think that you should actually expect that your chiropractor have a table like this, especially if you are somebody that deals with some recurrent back injury, recurrent back pain, chronic, or even an acute flare-up of a chronic condition for the lower back. That L4, L5, every now and again needs to get adjusted, and to have one of these available is going to be the difference between lying on the side and not being able to tolerate or having a real hard time or bad experience at the doctor's office, rather than actually coming here and getting that disc level primed, pumped, and then set properly so it can heal optimally and get you back into get you back in the groove of moving, feeling better, and getting the full benefit of not just chiropractic, but again, that acute chiropractic visit that we've seen on the internet, and that I want to show you and explain to you how that's reproducible and why it works and what it takes for it to work. And as a bonus to this video, what we do oftentimes is work with pregnant patients up until days before their delivery. We actually just had one, congratulations. And the abdominal piece, again, going down, we can set the amount of tension that we need for somebody who's pregnant to be up here and be extremely comfortable. And if anyone out there would challenge how comfortable that would be, believe me, we add the pregnancy pillow up here as well. And then that creates a really nice extra cushion to really allow for additional comfort for the belly to be accommodated. And then again, that drops down even more as the pelvic piece. We can control the depth from the pelvic piece as well, and raise up the face piece, all that. All can be adjusted and accommodated with a table like this. Again, the high-low table. Everybody, thank you for tuning into this video. Hopefully you stuck around until the end. If you are a student in the Dallas, Texas area, or just in general, chiropractic students from all over the globe, if you want to have a specific seminar, it's going to be this January, late January, the last 3 Saturdays and Sundays of this January 2022. I'm going to be holding a seminar capped at 20 people per a seminar. The location has not been determined yet. It depends on how many people we get to commit. And it's going to be very specifically adjusting acute lumbar. So it's all about those acute disc injuries that come into your clinic, and you're like, oh my God, where do I go? What do I do? How do I assess? Where do I begin? How many visits? How will I adjust? Do I use the pull? Do I use the push? All this now is for the student. All that will be addressed, and how I've had a lot of success in practice dealing with situations like this. If anything, I would say it's probably the most comfortable thing I do in practice is see people in 10 out of 10 pain, absolutely can't get out of bed, have just the worst time. Putting on the shoes is an impossibility. They have to call out of work. Their spouse or their loved one is, driving them all over town, and this is where the magic happens. This is how I get them better, and I am going to conduct that seminar for you. People from Parker, thank you for signing up. Can't wait to share all that kind of information with you. And again, other universities, other students, if you want to get in, just give us a shout. All right, guys, you know how to find me. And again, thank you for tuning in. And until next time, it's Dr. Pearlman. Thank you.